Good morning. This is my 15th class on the chapter Therapeutics. Our today's discussion topics is abnormal constituent present in urine and its corresponding diseases. Now, abnormal constituent of urine. The substance eliminated in urine are normal metabolic product. They are urea, uric acid, creatinine, and certain salt like chloride and sulfate. Substance like protein, sugar, ketone bodies, and blood are not excreted in normal urine. They are excreted in urine some pathological condition. So they are called as abnormal constituent of urine. The presence of abnormal constituent in urine helps in the diagnosis of various systemic and renal diseases. Abnormal constituent and the corresponding diseases of urine are when protein excreted with urine, then it is called proteinuria. When glucose excreted from with urine, this is called glycosuria. And in the case of ketone bodies, it is called ketosis. And when bile salt and bile pigment excreted from urinary tract or urea, it is called jaundice. And when blood excreted with urine, it is called hematuria. Now, in the case of protein, normal urine virtually has no protein. The protein that is excreted is very insignificant, but protein may excreted in urine in some diseases. Of all the protein, like albumin, is readily excreted because of its small size. So, urine excretion of protein is referred as proteinuria. Now, the causes of proteinuria. Its causes in various reasons like violent exercise in the time of pregnancy, in the time of high fever, in the case of renal diseases, and in the case of abdominal tumor. Now, the test which identify protein in urea, those are heat test. When urine is taken, third full in the test tube, holding the bottom of the test tube, and top portion of urine is heated. Then 1 to 2 drops acetic acid is added. Turbidity or precipitate in the heated portion of urine indicates the presence of albumin in urine. And the second test is sulfosalicylic acid test. In this test, 2 ml urine is taken in a test tube. In the urine sample, a few drops of 25% freshly prepared sulfosalicylic acid is added. Then a white precipitate is formed. This white precipitate indicates the presence of albumin in urine. Now, the test of glucose. Normally, urine does not contain glucose, but glucose may excreted in urine in some diseases. Then it is called glycosuria. Now, definition. Glycosuria is defined as excretion of glucose in urine which is detectable by Benedict qualitative test. Now the mechanism. What is the mechanism? Glucose is present in the glomerular filtrate in the same concentration as in blood plasma. When blood glucose level is increased more than 180 mg per dilution, the glomerular filtrate contain more glucose. This excess glucose is not reabsorbed. It is excreted in urine producing glycosuria. This blood glucose level of 180 mg per dl is called as renal threshold. Glucose appears in urine only when blood glucose level is 180 mg per dl or more. Now, the causes of glycosuria. When a patient have diabetes mellitus, when he or she have renal glycosuria, or in the case of pregnancy. Now, the qualitative test for glucose. Number 1, Benedict test. In this test, 5 ml of Benedict reagent taking in a test tube, and then few drop of urine is added. Then boil the sample for 2 minutes, and after 2 minutes red color precipitate is found, and this red color precipitate indicates the presence of reducing sugar like glucose. In the second test, this test is Felling's test. In this test, 1 ml of urine and 2 ml of Felling A and B solution are mixed in a test tube and boiled for 2 minutes. Then a brick red precipitate is formed. This brick red precipitate indicates the presence of reducing sugar like glucose. Now, in this class, we came to know about two components, protein and glucose. In the next class, we discuss about ketone bodies, bile salt, bile pigments, and blood, and their related diseases. Thank you.